Hi, everyone. We are having a CancerBuddy Conversation live, and let me see who is here to join us. And I'm looking for Dr. Worster. Hi, Ethan.
Hey, how's it going?
Good.
Good. Good to hear your voice.
Yes, am I not on camera?
You are not on
Yeah.
camera, but I'm on camera, and that's all that matters, right? No,
Yes,
I'm
that
just
that is
joking.
all that matters.
Hey, good evening, everyone. I hope everyone's doing well. We are just working through some technical stuff going
Exactly.
on right now, but I'm excited to join Cancer Buddy, and we have Dr. Brooke Worster coming on in a minute,
Yes.
and we will be sharing our stories about medical cannabis and cancer,
Yep.
me from the patient perspective, and Brooke is the chief medical officer at EO Care, and she's also with Jefferson Health. So we're really
Is
excited to
she
hear what she has to say as well.
is she coming on through the EO Care
Brooke
or?
is
Hi,
here.
can you hear me?
Yes.
All right.
Perfect.
Welcome, both of you. So, just to give a little introduction, I don't know why my camera's not working, but it doesn't matter as long as everybody can see the two of you. I'm Christina Merrill, and I'm the CEO and founder of CancerBuddy and the Bone Marrow and Cancer Foundation. And I want to welcome Ethan Zohn, who is a cancer survivor, and he is a celebrity and our EO ambassador. And he's obviously, many of you know Ethan as the winner of Survivor Africa. And also, I want to introduce you to Brooke Worster, Chief Medical Officer, as Ethan had just introduced her, and Director of Division of Supportive Oncology and Medical Director of Cannabis Medicine for Science and Business Master's Program at Jefferson Health. So welcome to you both. And to speak about the importance of cannabis in cancer care and on CancerBuddy, which is our app to connect patients and survivors and caregivers with each other to find support and connection. So welcome.
Thank you, Christina.
Yeah, thank you for having me.
So I
Thank you
think
for being here.
the way what's going to happen tonight is, Brooke will introduce herself, give a little background on, her role at Jefferson and EO, a little bit about medical cannabis, and then I'll jump in with a little bit of my personal story and why medical cannabis is such a huge part of my survivorship and while going through cancer treatments. But Brooke, why don't you just do a quick
Here I
introduction, and
am.
then let's educate these folks about all the wonderful things about medical
All
cannabis.
right, let's do it. Thanks, guys. My name is Brooke Worster, and kind of background is I am an internal medicine doctor and also did training in pain management generally, and then a part of that called palliative medicine. And I started specializing then in cancer pain management, really specifically, and moved to Philadelphia and joined the Sidney Kimmel Cancer Center and worked there seeing patients for a while. And to be honest, kind of hadn't thought much about cannabis, and patients and their caregivers came to me all the time and said, like, what about this? Is this a legit thing? And for a very sort of short period of time, I just kind of said, I don't really know. And I didn't learn a lot about this in medical school. And like, we've all smoked pot in our dorm room or whatever, but like, I don't really have any medical kind of anchoring to give to you. And that felt pretty crappy. And so I started to dig into, what was out there in terms of kind of medical education about cannabis and its use in cancer patients. And there wasn't a lot. There wasn't even good kind of training for medical providers on this. And so that felt bad. And I then had kind of the fortuitous benefit of getting into research about cannabis because in the state of Pennsylvania, so it was right around 2016 when Pennsylvania was sort of starting a medical access program for patients. And so I kind of dove in and I got really interested in doing research, and then got a couple of big grants from the National Cancer Institutes because they are increasingly interested too. And through that path, kind of met Ethan and got connected to EO, because one of the biggest things I realized is like everybody was doing this in a silo, right? Like patients and caregivers were interested, but didn't really feel comfortable talking about it or asking their doctors. They were maybe walking into dispensaries and getting a bud tender or, you know, someone that kind of didn't really have any medical knowledge giving them guidance, or they were being given something, you know, in a baggie from a friend and who meant well, but like didn't really sort of have an idea of like what's what here. And so we started at our cancer center a clinic to help guide patients towards sort of wise, beneficial, non-dangerous use of cannabis. Because the other thing that I saw that was really problematic was cannabis is expensive, and there's a whole lot of socio-political background about it that made it not equitably accessible to all of our cancer patients, especially patients that lived in more rural areas, patients that had black or brown skin, patients that were older. There were all kinds of these barriers. And so we wanted to sort of create a less restrictive environment for people to talk about this. And so 8 years later, here I am. We've seen over 4,500 patients. We have 5 nationally funded grants going, and I kind of get the pleasure of working with Ethan and the team at EO to help think about how do we kind of bring cannabis to people in an informed way. So that's the background of me.
Ian, can you just say a little bit about EO to our audience, just so they know about the company? And yeah, either Ethan or Dr. Worster.
Sure. Ethan, do you want to go first, or I can too, whatever? You're I can't hear you actually.
Oh, there we go. Am I there? How's
Yeah,
that?
there you're there.
Yep.
There you go. All right. EO is a digital health platform, and we provide personalized, physician-guided medical cannabis care plans for cancer patients, survivors, and caregivers. And we can get into that in a little bit later. But Brooke, do you want to just share a little bit about kind of, cannabis and cancer and how it affects the body and how you've seen it benefiting some cancer patients that you're working with?
Absolutely. So to sort of take a step back and talk about why is this sort of even a legitimate medical therapeutic, is that we have this thing in our body called the endocannabinoid system. And that is a system of receptors all throughout your body, brain, spinal cord, kind of peripheral organs, nerves, all of that, kind of very, very complex and developed system that has receptors that actually your body makes chemicals that mirror the compounds in the cannabis plant exactly. So THC and CBD are 2 of the biggest well-known, and they have very specific chemical structures. Your body produces something called endocannabinoids, and that's something that looks chemically similar or exactly the same as those chemicals that are in the cannabis plant. You just do it in a much lower dose. It's exactly the same effect as things that are like oxycodone, just in a lower dose. And when you give someone a higher dose, you get an effect that you feel, right? Mm-hmm. So that's why there is this really interesting, complex, and scientifically kind of valid question of like, what's the what with cannabis, right? It mirrors things that our body has kind of evolved to say this is a necessary or helpful kind of composition or chemical in our body, right? So that's sort of the background of it.
Yep.
And what you do when you take cannabis from outside and ingest it or inhale it or put it on your skin is that you're giving yourself levels of those compounds in a high enough kind of state that you feel a physiologic effect. So for the THC, which is the easiest one to think about, it kind of crosses into your brain and it attaches to those receptors that are in certain very specific areas. For instance, one not very eloquently named vomit center in your brain actually responds to THC. And so when you ingest or inhale THC and it crosses into your brain, it reduces the activity in your vomit center, aka chemotherapy-induced nausea and vomiting. You can reduce the activity there that's triggering you to feel nauseous or vomiting, just as one very concrete example of like, why does this work? Same thing goes for sort of the perception of pain, right? You might have pain in your arm, but there's a complex sort of winches and pulley system that makes it signal up to your brain that you feel it. And so when you ingest cannabis, you are affecting both some of the inflammation that's in your arm, maybe, and the way that your brain is perceiving that pain. So those are just two sort of, you know, very concrete examples of why your body can respond to cannabis for certain very common cancer-related symptoms.
Interesting. And so as a oncologist or a MD, do you advise your patients, you know, to disclose that they're using cannabis? Because I know, like, in some states, maybe people who are on the, it's illegal. Some states it's adult use. Some states it's only medically available. Really confusing. You walk into a dispensary, it's like, it's overwhelming. There's so many products and things to try and what to do. So when you are working with a patient, like, what do you tell them about the legality and what products to use?
It's a really, really good question. And I think it's all overwhelming. And like, we didn't even mention the whole, like, get on the internet, Google cannabis and the sort of ridiculous amounts of hits you're going to get about products that are available, or Reddit threads, or, you know, all that stuff, right? So what I say to people is, one, please feel comfortable and confident as much as you can discussing this with anyone on your healthcare team, right? ASCO has come out with new guidelines that say the number one thing that all of your clinicians should do is create an open and non-judgmental space to talk about cannabis, because it's important, right? And it might affect other things if we aren't disclosing that. And we can talk about that later. But I say to people, one, talk about it, right? Let's ask the questions. Let's talk about it in a healthcare setting. And that's our job just as much as yours, right?
Does the normal oncologist or transplant doctor, they don't know, they don't have the knowledge. So when I've spoken to my patients about it, and we've gone and spoken to their doctors about it, the doctor goes, well, just as long as you don't smoke it, you can eat it, but don't smoke it. That's all really that they say. They don't have any other information on it. So it still leaves the patient really uncertain about using it.
Oh, spot on, right? I do not think that healthcare and your clinicians, they're going to be wonderful in treating your cancer, right? But they're not going to have the answer for you about cannabis by and large. They haven't learned about it. They don't know, right? That's where actually, for sure, EO is kind of the nuts and bolts answer of how to do this, what product, what to use, how to get kind of feedback about dosing in your own body, because your body is going to react different to it than Ethan's might or mine might, right? So you need to have some sort of personalized answer. I'm just saying it's always good to be transparent about what we're using, no matter what, right? And then it is very dependent based on what state you're in as to how you can access cannabis, if you can access it in a state regulated dispensary or not, and what products that dispensary might have. Again, I would tell you that's exactly what drew me to say the EO platform is something that can sort of on a large scale enable patients to understand this. They will help you understand what is happening wherever you're located, and they'll be able to kind of get you access to safe products that aren't like something you're Googling or something you're getting from a neighbor or anything like that. The biggest thing that I tell people in terms of like the legality of this is that in this country, you cannot in any state with a amount that is a personal amount. We're not talking about like ounces of stuff that you're trying to sell or anything like that. There are now no states where you're going to be at risk for sort of getting legally in trouble, sent to jail, doing anything. We're not talking about driving while intoxicated. We're not talking about operating heavy machinery. We're just talking about possessing it. So please don't feel like you can get in trouble legally for using this as a medical therapeutic.
That's really good information.
And besides the, vomit, the nausea that, turns it off, that part of your brain, and pain, what other benefits does cannabis, have for patients that are going through treatment or that are
and
post-treatment?
while we're at it, are there any risks
Yeah.
involved for a cancer patient?
Great questions. Great questions. So here are kind of in order of the frequency that I get asked about it and the data behind it is nausea and vomiting, cancer pain, then anxiety.
Yeah.
Mm-hmm.
And anxiety is a very common, very under discussed prevailing symptom of sort of, or side effect, right, of just being in the cancer space.
Yes.
Mm-hmm.
There is increasing evidence that cannabis can be quite helpful for that. However, I will tell you, when people go at it alone, what they tend to get are products that are very high in THC.
Yeah.
High THC cannabis products actually can induce or exacerbate anxiety. We do know this. When people use high enough products frequently enough, they can actually develop episodes of psychosis, right? Or significant paranoia. So where the data is behind products that have high CBD. And that's often just not what you're told in a dispensary or have easy access to. So that's one of the spaces where sort of having some guidance is really helpful. Insomnia, which I would sort of put right in that space of like, is it caused by pain? Is it caused by anxiety, right? Like you can see how cannabis can be helpful for that. Mm-hmm. People with primary sleep disorders, way less so, right? Cannabis isn't going to fix that. But if it's driven by anxiety or pain, for sure, sort of lump that in that kind of cluster of symptoms. And the other one, which is actually funny because I don't know if it was, Cheech and Chong or, the whatever it was, everybody talks about the cannabis. And people say, I've experienced that or ha, ha, ha. But actually, people will ask about it being an appetite stimulant. And for sure, there is this idea that it can stimulate kind of hunger via your centers in your brain. We just don't have any data around it. So when people say, like, where's the data behind this? Because of it being kind of this Schedule I substance and, there being very kind of complex challenges behind doing that study, we suspect it's helpful. And frankly, we don't have a lot of other good tools that are prescription for appetite. So appetite is one where I say, listen, there's a lot of reason why people want to reach for this. It may or may not work for you, but I get it. And I don't have a different pill to give you for that. Mm-hmm. Risk-wise, here's two things that I want people to really pay attention to. One is the inhaled part. Absolutely. If you are a hematologic malignancy patient or someone that has anything that is kind of proceeding to a stem cell transplant and you are going to have no immune system and it puts your lungs, you have a higher risk of actually developing what's called pneumonitis, or this inflammation in your lungs that can affect your breathing. Inhaling anything into your lungs during that time period is not safe. It can trigger that, and it doesn't have to be nicotine based. It doesn't have to be cannabis based. Inhaling anything, right? So I agree. Don't smoke, don't inhale if you're in that space. The other area that I tell cancer patients that we are working on getting more data and understanding is when you're on immunotherapy, high doses of CBD can affect your immune response potentially. And so kind of not diving in whole hog with, hundreds and hundreds and hundreds of milligrams of CBD if you're on immunotherapy is another sort of thing to talk about your oncologist with.
Yeah. Excellent. Thank you so much. I'm curious, for those who are in the chat, if you can, I don't know, a thumbs up, or how many people are, medical cannabis users who have used cannabis before. I'm just a little bit curious to understand that more. But yeah, that's hugely important. And like everything you're saying, obviously kind of mirrors my personal experience for when I actually was going through cancer. And so a quick background on me, as I was 35 years old, training for the New York City Marathon. And I was diagnosed with a rare form of blood cancer called CD20 positive Hodgkin's lymphoma. Trust me, I had never heard of it either, anyone. So, I tried, everything on the market to try to get myself finally diagnosed. And I went through multiple rounds of chemotherapy, 22 blasts of radiation, and I did an autologous stem cell transplant and then an allogeneic stem cell transplant. And so for me, when I was going through treatment, I was plagued by everything, loss of appetite, anxiety, no sleep, pain, everything. I had it all. And so the doctors, obviously, most of us know here, they prescribe me with a whole host of synthetic pills. And I always find it fun, or not necessarily fun, but interesting to read them to everyone. And I write them down. But Percocet for pain, Zofran for nausea, for anxiety, Ambien for sleep, Lexapro for mood, Ativan for more relaxation and nausea, Adderall for I was crushing Ensure to try to gain some weight back. That was what I was taking every single day. Or I could have a pot brownie. For me, back in 2009, it was really hard to access cannabis. I was on the streets of New York City with chemo. I got gloves on, I got a mask, and I'm talking to a drug dealer, which was really unsettling. Doing a illegal activity on top of already having cancer was just a horrible experience. And I just wanted to get like an alternative form of medicine to help myself feel better, right? And it was all we know, like having cancer is a really uncontrollable feeling. So you're always like looking for little things to just gain the control back over your body and your mind and your spirit. So for me, I was leaning into cannabis, and I had never touched the stuff because I was a professional athlete. Sports was my thing. I always kept cannabis separate than sports, and it just wasn't my thing. But obviously I knew the benefits of cancer because, I went to a liberal arts college in upstate New York, and it was everywhere. So I knew about it. I just wasn't for me. And so, cannabis was a huge help for me in the sense that, and I don't know if anyone else feels this way, I was always chasing a feeling when I was taking some of these pills. Okay, I was in pain, so I took a Percocet. I had to wait, and then 4 hours later it's going to wear off. So I had to time my Percocet with my sleep, and then I got to drive someplace, or I want to work out. And so it was always chasing a feeling and trying to schedule the time and the feeling, and it was just a horrible experience. So cannabis for me just balanced me out. It was, I guess, a more predictable, consistent form of medicine. And for me, I just wanted to be balanced. I didn't want to go through the highs and lows of ups and downs and sleeps and not sleeps with these pills. So for me, it was a huge help. The other side of it was, like you said, Brooke, like I had no idea what I was doing, right?
Yeah.
Like no one at my hospital, Memorial Sloan Kettering, could talk to me about medical cannabis. No, not nurse, nurse practitioner, oncologist, anyone. Like I wanted someone to be able to like tell me, you need to use this strain. This is when you use it. This is the dosage. Don't take too much. If you're taking this pill, don't take cannabis with that. But it just didn't exist at the time.
When did marijuana become a medical marijuana legal?
I want to say around
In New York, you mean?
Yeah.
New York was like a year ago or 2 years.
Yeah, I was going to say New York was like 2018, maybe.
Okay.
But I think the first state might have been, Colorado or
first state for medical, just as like a little bit of cannabis kind of trivia, it was California, and it was actually because of the AIDS epidemic. It got approved on a ballot measure in California back in the 90s for compassionate use.
Wow.
And that was the only state for a very long time, and it was driven solely at that point at the height of kind of the 80s and the 90s. Back, it was 1986, I think, is when it was approved for that as a compassionate use.
Wow.
But it's taken, think about it, that's a long time, and we're still at a state where we're kind of going like, guys, we need more help, we need more guidance.
Yeah.
So Ethan,
especially with you, like when you probably asked any of your doctors about it, they probably wanted to keep at arm's length because they don't even want to be involved in it.
No, yeah. And even now I visited a medical, because, sometimes you have to get certified and get your medical cannabis card. So I went to a medical cannabis doctor.
Yeah.
I told them everything about myself, and they responded to me by saying, okay, I advise you to go to a bunch of different dispensaries, try a bunch of different products, see what works for you, and then just kind of continue with that product. And I was like, well, first of all, a dispensary is not a hospital, a bud tender is not a doctor, and you're going to tell like a guy like me, like what products to use, that's insane to me.
Yeah.
Like, there's a huge gap between the medical industry and the cannabis industry. And Brooke, like, if you're going to prescribe someone Percocet or Lexapro, you're going to say, you're going to take one Percocet every 4 hours. I'll check in with you tomorrow. I'm going to see how you're feeling. You would never prescribe that without oversight.
Yeah, no.
Yet
It's
everyone
funny
in the
because
country is prescribing
right.
cannabis without any oversight. It's insane.
Yeah. I would love to hear if anybody that's here has any questions as we're talking.
Yeah.
Certainly happy to try to answer yours. But Ethan, I like love hearing your journey and the guidance that you're providing people. What's the difference that you would say to sort of how should people that are kind of in the beginning of their cancer trajectory, how would you sort of say how to tackle this if you're interested in a different way than you had to?
Well, first thing, I would let your oncologist or doctor know that you're interested in trying medical cannabis, and just first see if there are any issues based on your condition or the medicine you're already on. That's the first thing. But, there are a lot of good synthetic pills out there. Like, I'm not going to say like Western medicine, chemotherapy, radiation, they cured my cancer, but I really feel like cannabis saved me, saved my life. But I would suggest everyone, if you feel you need it and you're interested in a plant-based solution and try to reduce the dosage of some of your meds or get off some others completely. That's what happened to me. I couldn't remove all of them. I reduced the dosage of some, I got off others completely. But I would definitely suggest speaking with a medical professional about medical cannabis and help someone guide you through the process. And as I don't know if anyone knows, but I didn't really know, there are capsules and there are tinctures and there are inhalers and there's bombs. There's vapes, which I don't necessarily, think you should do. Obviously flower, which I don't think everyone should do. But there's so many different forms of cannabis that can impact you in beneficial ways. And I definitely think people should educate themselves about it. And obviously we're talking about EO Care here, but that's exactly what EO does. We are a medical cannabis platform where you can sign on, you fill about everything about yourself, all the medicines you're currently on, the cancer you may have, the issues you're facing, and then our technical and our medical professional clinical team will create a care plan for you, and then they'll give it to you. And then they'll prompt you every 3-4 days to see how it's going. Oh, how did you feel this morning? Oh, did you have a little bit of a hangover? Were you able to drive to school? Was that too much dosage, too less dosage? And then we'll tweak the plan as it goes on and advise you on kind of how to change the plan to make yourself feel better. And in addition to that, we'll help you choose the products that are best for you. And we either pick them from a local dispensary and get them delivered to your door, or we actually are now developing a form of products that Brooke is formulating with a scientist that is specifically formulated just for cancer patients, which I've been trying. I'm a product tester, which is pretty awesome, but they're really beneficial and really effective.
That's really great to hear. EO, do they have, do they like smoking it, taking it through different tinctures? Like, what is their?
So here's the thing, and I think this is one of the things I have learned about cannabis is that there's not a one size fits all, right? And so it's pretty important not to say, like, I think what some doctors that started paying attention to it tried to do was be like, go get the tincture, take 3 drops, right? Like, no matter what, who knows what tincture, right? Whatever, but that was like enough, right? So the way that EO works is that you put in your information, your personal, they'll ask you some basic questions, right? Like, what are you looking for help with? What do you want to avoid? Meaning, like, I don't want to feel high, or I don't want to smoke something, or, whatever. And they'll say, are there forms that you either very much want or want to avoid? Because some of it comes down to, right, like, we want this to feel like it's in the way that all good medical care should be, kind of a joint decision-making process, right? Like, I shouldn't just throw this pill at you because I say it's right. So what they're going to do is ask, do you want something that is in the form of something you eat, or something you swallow, or something you put on your skin, or whatever? And then the platform uses this, like, very cool, very above my head kind of AI kind of ability to scrub all of the data that is out there and published. And based on sort of what you're looking for and your cancer and what you want to avoid, it is able to kind of generate a recommendation, meaning a starting dose of a product, how much THC and in what form based on what you're saying. So they're not gonna pick just because we've sort of, as a medical professional, I've said, like, I don't really want anyone smoking something. So they're not going to recommend, here's a joint. If you say, I very much want to inhale something because intolerable and I can't imagine swallowing anything, they're going to recommend a vaporized product for you that doesn't have 99% THC and is going to knock you off, you know, whatever. So they will do it in a way that kind of meets you where you are, which I think we should all try to do in sort of as much as we can with any medical care.
Yeah, I mean, in addition, like EO is, we have multiple different ways to kind of get in touch with us. We have, like what Brooke was talking about, we have an AI chatbot that we've trained with all this published data on medical cannabis and different cancers and dosages, like Brooke mentioned. We have, you can email the EO care team, and the email address is cancerbuddy@eo.care. You can get in touch with us via Instagram. You can DM EO if you want to.
And join our group.
Oh, yes.
We have a group on CancerBuddy, an EO CancerBuddy group, and Ethan's a host with other medical care team members of EO. And so we're excited to have this group where you can ask questions and get, you know, quick responses from them and so forth.
And if you are a member of CancerBuddy, EO is giving everyone free care plans. So if you're interested in it, you can get a free care plan and see what it's all about. And if it's not for you, if cannabis isn't for you, please just tell any friends or family or fellow cancer survivors or cancer warriors that are interested in using manual cannabis and just might not know how or why or where to start, please direct them to EO. And it's an interesting stat. 40% of cancer patients use medical cannabis. I think around 25% more would like to use medical cannabis. And I don't even know the percentage, Brooke, but a lot of medical oncologists do not have the information or education to, I guess,
it's like one of the starkest divides that we've seen in our research, where a good percentage of your oncologists in a national survey responded that they think there's benefit to it, right? So over 75% of oncologists sort of felt strongly that there was benefit. Less than 25% of them felt like confident in their knowledge of it. And like that's across the board. It's not just an oncologist, a primary care physician, a radiation oncologist, a surgeon. Like, they didn't teach us about this in medical school. You know, maybe it was 20 minutes lumped in with kind of drugs of abuse, right? Because that's sort of where this came from. And the tide is shifting, right? We're talking about cannabis is going to be rescheduled, which will be great for research and access and all of that. So I think this is a really important sort of time and space to be having this conversation and empowering you guys to take some control. Because I will tell you, and Ethan, you're the patient here, so, you know, please correct me if I'm wrong, but I think one of the worst parts about cancer is that it takes away so much control. And so any modicum of control that you can have in terms of your quality of life and your symptoms, grab at it. And this is a small bit of it, right? Just a small bit, but like well worth it to kind of look into it and feel like you can educate yourself in a way that you feel confident.
100%. Yeah. Like when I was going through cancer, I tried everything, obviously all the Western medicine, but I was doing visualization and, you know, I was doing, you know, Reiki and acupuncture, massage. I met with a shrink, cancer support groups, medical cannabis. It was just another tool in my toolkit to help me get through this incredibly challenging time. And for me, the post-cancer was more difficult for me than actually going through treatment, if you can believe it. I was plagued with incredible anxiety and fear of relapse that got to a point where I really couldn't even leave the house. And that's when I really dug deep into CBD and medical cannabis, and it was a game changer for me. But I think we got a couple minutes left. Is anyone who's on the chat right now, if you have any questions whatsoever, throw them right here in the chat before we finish up. But like I said, go out to eo.care, check it out, play around. If you want a free care plan, let us know. We're happy to provide that for you. If you have any questions, DM us, email us, call us, all the whole bit.
And patients send their, suggest to their doctors to call EO and ask for information or
There's a
talk with you.
portal
Mhm.
that is for medical professionals too.
Yeah.
If you have an interested medical professional that wants to get some more information and learn, they can go on to the AI driven portal, and it'll reference things. It'll give them data. It'll give them articles. It'll, it's a nice thing for medical professionals too, if they're interested. You can also send your care plan or show your care plan to your doctor so that you can help educate them and say, like, here's what it is. Here's the exact composition. Here's the exact dose. Here, this is the way it's working.
Yeah, it tracks you and everything you're doing in cannabis. And you just hand that over to your doctor for an extra oversight, I guess you could say, of what we're doing.
That's great. That's great. Well, this is great information.
Yeah, well, thank you. And yeah, I'll be dipping in and out of the CancerBuddy group, the EO Cannabis Care group in the CancerBuddy app. So I'll be poking around. If you have any questions for me in there, shoot them in there. But once again, I truly appreciate everyone showing up and listening to Brooke and I, and appreciate you hearing our stories.
Yeah. And thank you, everybody, as well. And thank you, Ethan and Brooke, for being a part of this and sharing your great information and personal story, Ethan.
Thank you so much. Yeah. We'll see more of you in the future, definitely.
Yes.
Absolutely. Thanks, guys.
All right. Thanks. Bye, Brooke. Bye, everyone.
Bye.